Thank you. I think the question you asked was, what does America First mean to me when I think of it as far as healthcare? And I think it's about the American people. And also, it's not about the U.S. government. That, to me, is one of the biggest problems that we have. When I first ran for office, people said, why are you running for office? I said, I think we got people in Washington that are making business decisions that never ran a business. I started with my own practice with 2 employees and then joined a large orthopedic group. We got people making healthcare decisions that never saw a patient, and people making military decisions that never served. And but as I think about it with healthcare, it's about putting the patient and the doctor back in charge, which is the theme here today, and I greatly appreciate that. It's about making America the place for innovation in healthcare and new treatments and cures coming from America. We don't want to lose that, and we're at risk of losing that. It's about transforming our supply chain so that we have a secure domestic source of pharmaceuticals and everything that we need across the board for our national security and our national health security. And it's about increasing access and affordability. Democrats like to talk about how you have coverage through this or that, but that doesn't mean you have access, and that doesn't mean you can afford it. So what we are about is to try and make this the healthiest nation on the planet, and what we can do to keep Americans healthier. We met as a doctor's caucus during the Obama administration with CMS, and the woman from there said, you know, all the things we're implementing are really starting to work with their electronic health record and everything else. I said, do you know why we're here? Because you've taken the joy out of taking care of people. We got to get government out of healthcare, because right now, when government acts, insurance follows.
Very well said.
Thank you.
Thank you, Kathy, and I just love your passion on this, because to me, it just seems, especially as a physician, it just seems completely immoral to even invoke a system like this where you're deciding basically who gets care and who doesn't based on what they may predict. You know, and as a doctor, I can tell you time and time again, a lot of times people beat the odds. And they live a whole lot longer than you expect, and all those types of things, especially when there's new treatments, new innovations, and that's what we're really about. You know, we reached out to stakeholders across the board with our Healthy Futures Task Force, right, Kathy? And, you know, our goals are to reduce drug costs. We have H.R. 19 out there, which is a bipartisan set of bills that will really reduce the cost of drugs without stymieing innovation, as opposed to what they have in Build Back Better. So I say to my senator friends here, I know Joe Manchin said he's interested in looking at lowering drug costs. That's fine. Why don't you have him take a look at H.R. 19 rather than what's in the bill, Build Back Better? But we want to get things to market faster. We want to get things through the FDA faster. Operation Warp Speed showed that we can do a lot, and we can do a lot faster, and also focus on treatments and cures. Again, it's about people's health span rather than just their lifespan. You know, we do pretty well at keeping people alive for a long time, but how do we keep people healthier longer? That's really what we are after. We've got a bill to enhance and to inspire and encourage medical manufacturing in the United States. Again, going back to the supply chain issue. We can do all these things. We're teeing them up. We're going to be ready to go. Let's win in November and get our policies out there.
Thank you. Well, doing today.
Well, I do want to give Leader McCarthy a lot of credit for putting this all together. And as we have these task forces, they're on energy and every topic that we can think of that we deal with. And so this has been a great opportunity, but it's not only for the people that are selected to be on different task forces, it's open to every member. And so every one of the task forces is open to every member to participate, which I think has been very good, which will really enhance what we put forward in the fall. But as I was talking about it before, you know, we're about treatments and cures. We're about access to care, reducing the cost of drugs, and really the affordability of care. And so we have a lot of things that we have put forward, but it's also the process that's taking place in medicine today. I know the theme today is about the doctor-patient relationship, and I greatly appreciate that, because it's been stripped in so many ways. Imagine if you're a lawyer and a client comes to you and says, hey, I'd like you to defend me in this case. And you had to say, well, let me check with someone to make sure I'm able to do that first. Or, before I can write this contract for you, somebody has to give me permission. Someone who doesn't know you, someone who's not familiar with the case. That's what is going on in medicine today. We have to get prior authorization for everything. They tell us which drug we're allowed to prescribe for our patients. So we have bills that are teed up to combat that, to put that back in the doctor's hands with the patient so that it's not dictated to. But I've always said to the insurance companies, if you're going to make these decisions, then you need to see the patient. You should not be making these decisions for a patient you have never seen. To me, that's malpractice, and it's occurring each and every day. And with that, we've got to enhance the transparency. Thank you. We passed in a bipartisan fashion the No Surprise Act, which takes the patient out of the negotiation. If a patient has an emergency surgery, they don't get to choose who their surgeon is, and they may not be in network. We solved that. We solved it in a good way that made it fair to the insurance companies and to the physicians, taking patients out of it. And the government, HHS, changed our law, and it's in courts, and they're losing, but they keep appealing it. But let me give you one thing about taking physicians out of your care. Nothing is more egregious than the vaccine mandate. Look, I've been vaccinated. I was for the vaccine. It saved hundreds of thousands of lives. But the mandate, you have someone in politics who has no experience in medicine telling you, you must get this shot, and if you don't, you're fired from your job. Is this America? It sure doesn't sound like it. Where is the relationship with the doctor? There is no conversation with the doctor. It is government coercion rather than the art of persuasion, which is really what we call bedside manner in America. And they're taking us out of the equation altogether. And, Americans, by the way, don't do very well with "I told you so" after about age 4 or 5. I have a 4-year-old. I think it is 4. and that's basically what has gone on here. We've got to get the doctors involved with your care more. It's personal, and it's between you and your doctor, and every patient is different.
Thank you.